The International-Rett-Syndrome-Foundation was formed in the mid-1980s when a small group of passionate and determined parents banded together with a purpose to improve the lives of their children and to drive the research, advocacy, and awareness of Rett syndrome. They knew that on their own they could only do so much, but working together they could do so much more. The core mission of our organization is to fund research for treatments and a cure for Rett syndrome, while enhancing the overall quality of life for those living with this crippling disease. The Foundation also places great importance on advocacy and raising awareness so the scientific and medical communities, along with policymakers, educators, caregivers, and the general public, are better informed about Rett syndrome and motivated to help research efforts. The International-Rett-Syndrome-Foundation has awarded over $30 million since 1998 in direct support of research grants towards innovative basic and preclinical research. The Foundation has top-notch advisors that assist and consult on science, research, medical care, and quality of life. Additionally, we work closely with the National Institute of Health to promote research on Rett syndrome and advocate in Congress for increased support of research. Our effectiveness stems from a blend of credentialed professionals and passionate, skilled parents on our board and staff. With the guidance of our medical, scientific, and family support boards, the right equation is created for unbiased, strategic decision-making fueled by the passion of the very people who stand to benefit the most by the success of our organization. Those families affected by Rett syndrome, most importantly, the children diagnosed, make people want to work harder, dig a little deeper, and this makes us effective in what we do. At the IRSF, we measure success by the progress made by our talented research partners. We aggressively fund critical research, and we were the first Rett syndrome organization to fund a human clinical trial. Since 1983, we've identified Rett syndrome, discovered the gene, reversed the syndrome, created new testing models, and are currently funding multiple clinical trials. We're the only organization that ties 50 states and over 70 countries with a common goal towards research, awareness, advocacy, and support for this debilitating disease. Some people say that IRSF's multi-pronged mission of research, care, and awareness spreads us too thin to truly accomplish our goal. In fact, the opposite is true. We see the entire problem and bring together the cast needed to solve this mystery: the child, the family, and the community. Our staff is small, but we are well-informed and skilled in our respective areas. We intend to end Rett syndrome, but we will not leave our children alone, and we will not stop advocating for them while we pursue this goal. We're the only Rett syndrome organization with a 4-star Charity Navigator rating and the only one sponsoring multiple clinical trials. IRSF has awarded over $30 million in direct support of research grants that include a balanced portfolio of discovery-based, basic, and translational research. We also feature the only mentored training fellowship program to attract young, talented scientists to Rett syndrome research. We often say, care today, cure tomorrow, and these are more than just words. The search for a cure is our primary focus, and we are proud to be at the forefront of this important research. But we're equally proud of the role we play in the lives of families, whether newly diagnosed or living with Rett syndrome for decades, that we help cope with the brutal realities that accompany the syndrome. One of the major challenges we face is Rett syndrome is a rare disorder. We estimate that for every diagnosis that we know of, there are 2 others that have not been diagnosed. Historically, we found that people with Rett syndrome have been misdiagnosed with cerebral palsy, or the family is simply given the diagnosis of pervasive developmental disorder. We've worked to educate physicians to recognize the classic characteristics of Rett syndrome and we're finding that more children are now being correctly diagnosed and at a younger age. With additional resources, we would invest more funding into translational and clinical research. Right now, we're the only organization funding clinical trials, and these are very costly. There are so many therapeutic avenues to investigate and available compounds to test. The greatest single accomplishment that IRSF could bring to the Rett syndrome community would be actual treatments, and the only way that can happen sooner is with additional funding. One gap our community faces is the impending shortage of trained neurologists committed to focusing on Rett syndrome. This is a problem that could reach threatening proportions in a few years. If the funding were available, IRSF would invest financial resources to recruit a sufficient number of dedicated neurologists who make Rett syndrome research and care central to their work.